Hello, everyone, and welcome to the Health Leaders Podcast, the place for peer sourced and solution focused insights for healthcare executives. My name is G. Hatfield, and I'm the nursing editor for Health Leaders. Today, we're talking to Betty Jo Rocchio, who is the Senior Vice President and Chief Nurse Executive at Mercy, about Mercy's new Nursing Innovation Unit. So, hi, Betty Jo, how are you?
Hi, so nice to be here with you today.
Great. So let's jump right into it. What's the vision behind the new Nursing Innovation Unit?
Well, one of the things that we're pretty passionate about at Mercy is our nurses' experience or joy in practice. And this year, we've had an extreme focus on three things: workforce, work environment, and workflows. And as we took a look at that, we realized some of the friction that was occurring at the front lines and increasing workload for our nurses. So we really wanted to take a frontline approach in trying to solve that with them.
Perfect. So how long did it take to plan and build the new unit?
So it took more planning than some of the actual building because we did it with our frontline coworkers. And it wasn't just
Mhm.
nurses, it was our techs, some of our LPNs, RNs, and then ancillary personnel that are in our units because that workload is driven by all those intersection points. And so having the frontline staff walk us through a day in their life and then
Mhm.
start to look at it from a nursing informatics perspective was key to this work. So it took about 9 months to
Oh,
actually
wow.
start to look at what that might look like and what places we needed to touch in their daily workflows.
Absolutely, yeah. So where's the funding coming from for the new unit?
So the funding is coming from a lot of different places, but one of them is reducing that workload at the front lines is increasing our retention rate. And
Mhm.
so I don't mind sharing with you that during COVID, our turnover rate was right around 28%. And
Oh,
so
wow.
I know, and that was right in line with the national average. That's if you think about it, that's a lot of people leaving your organization and then retraining them. And one of the things that was significant in trying to reduce that, we're at about 14% today. So we've
Mhm.
basically cut that in half by focusing on getting enough workforce and then reducing that friction in their day. And so when you consider nurse turnover is average in the United States today at about $50,000 per nurse,
Mhm.
when you cut that in half, you're saving a good bit of money. So the funding is really coming from Mercy, but it's coming from the savings in our turnover rate.
Absolutely. That's really impressive that y'all were able to do that. So what kind of new technologies are inside the unit that the nurses can utilize?
I want to highlight that it's the technology is important, but
Mhm.
technology sometimes can be a big disruptor to workflow too. So there is some technology that we were talk about, but the innovation is really streamlining the work in our electronic medical record. And some of the technology we're using to do that is we're using something in Epic called Rover, and it's
Mhm.
real time charting. So, in a nurse's workflow or even in a tech's workflow, they would normally do a function and then have to go back into the computer to chart it. Today, we use mobile phones just like we do in regular life.
Mhm.
They're secure in our hospital system for our private patient information, but they're using that in the moment to chart. They're scanning all their supplies with it, they're charting with it. They're able to do their assessments and then talk the assessment and have it go back into the electronic health record. So we're saving a couple of hours a day by putting that into the workflow. So that's one of the big technologies that we've lifted. And I'll just be honest with you, it was a heavy lift because we had to
Mhm.
standardize that EMR documentation and then we had to make it mobile. So it was, and we're still going through it. It's not completely perfected,
Mhm.
but on this unit, we're working through what that perfection looks like before we launch it across all 45 hospitals.
For sure, yeah. What are some of the ways that you're seeing technology interrupt workflow? I know you mentioned that.
So, for example, if we would have launched that rover functionality, right, to be able to chart in the moment, but we didn't clean
Mhm.
up how nurses were actually charting in our EMR, that would have been
Mm.
nearly impossible to be able to do that. And so, working on that was key. The other thing that's key is taking our plan of care that's housed in our EMR and putting it up on an electronic board in the room so the
Mhm.
patient, the family, the physician, and anybody that enters the room understands what the plan of care for is for the day. That's become
Mhm.
important for goal directed therapy for our patients and that interdisciplinary approach to be to allow all of our clinical coworkers to understand what's needed for that patient for the day. So when it's buried in that electronic medical record, it's really hard
Mhm.
to know what's going on. But launching it onto these electronic boards is really going to be the key to the future.
For sure. So what kind of nurses are working inside the unit?
So we've started on our med surge units for a couple of reasons. Med surge nursing um, has the highest workload, maybe not
Mhm.
acuity of patients, but the workload's high there because of the number of patients that they take care of and the different health needs of all those patients. And so when you take a look at nurse workload, that's the highest unit. We're struggling to staff those units in this country. So med surge nursing is got the highest turnover rate as well as the most demand. So we
Mhm.
thought starting on those units would yield us the greatest results. So that's where we started.
Gotcha. And how are the nurses chosen to work inside the unit?
We did choose certain nurses, though, to develop the concepts and text
Mhm.
with us. And we chose those people that were constructively dissatisfied. So, the squeaky wheel, right, gets most of the attention. We
Mhm.
love those people in this process because they're able to speak up, they're able to tell us what's bothering them, and we're able to solve problems with them real time.
Absolutely. And to kind of piggyback off of that, what's been the nurse's reaction to the new unit?
So it's interesting. It's the first time in my career, right? And I've been doing this for
Mhm.
30 years, that we are actually changing nursing practice.
Mhm.
We are using evidence based practice out there in the literature to decide what to include and not include. And we're doing it with our frontline. And I've never seen such a dramatic change or plan change um, with the way that nurses are practicing today. So they are
Absolutely.
so excited because they're contributing, right? They're contributing to it.
That's really great to hear. And you said that you guys are planning on launching it over 45 hospitals?
We will eventually launch it. Right now, we're still perfecting that innovation unit the way we want
Mhm.
it. And we imagine three phases. The first phase is launching, and
Mhm.
the second phase will be an optimization. Then the third will be really fine tuning the workload for the nurse and the tech.
Gotcha. So have there been any unexpected challenges or outcomes?
Yes, believe it or not, Um, getting technology to play nice in the clinical environment with that ease of use it's a heavy lift,
Yeah.
which is why it can be such a big disruptor because if it's not put in and worked into workflow, we end up working around the technology. So making sure that the technology we pick is delivering to the satisfaction at the front lines is key. And it's as simple as vital signs, right, being taken by a
Mhm.
machine and automatically having them documented in our electronic medical records. So nobody has to touch it.
Mhm.
Um, that was a heavy lift with a lot of interfaces and things that you wouldn't think in the background. So our Mercy technology team has really been working overtime to lean in and help us.
Gotcha. So how do you think this program will evolve over time?
I think it's going to be the standard in nursing. And I
Mhm.
say that because we're struggling and we've been struggling in med surg nursing more than any other type of nursing.
Mhm.
And I think we're going to have to connect it into our staffing and scheduling with a workload tool. So if we are doing something at the front lines, we should have a way to measure it. And I think we're going to start asking these nurses more about how they feel about the patients and start scheduling them by a workload number to group those patients rather than ratios.
Mhm.
And that is going to launch in that third phase that we talked about, the workload assessment tool that automatically makes assignments for
Mhm.
nurses based on workload of the patients. That helps our charge nurses and it helps our nurses with how they feel when they go home. And the workload measurement is not just objective, but it's also subjective, how the nurse felt at the end of their shift. I think that's a
Mm,
really important point, how nurses feel going home. We want to send our nurses home still feeling good with plenty of energy to be able to take care of their family, friends, personal lives, rather than leaving so exhausted from work. So it's going to be important how they feel and then what patients we group together. So we're building that now in the
mhm.
background. So the more to come.
Absolutely, yeah. So, what can other health systems learn from this new unit?
Just to be careful about starting small and trying to get as near close to perfect. You're never perfect as you can before you start to launch it wide. And about the change management that's going to be needed when you're changing nursing practice at this level, and doing it right in front of patients and physicians and other caregivers. You have to be certain that you've got it pretty correct before you start launching it across the system. So that's why we started in one unit with many ideas coming in from across the ministry.
Gotcha. Well, thank you so much, Betty Jo, for your time. And thank you to our audience for listening to the Health Leaders podcast.